Good afternoon, everyone, and welcome to day 2 of the Boys Town Pediatrics Newborn Expo. My name is Gabby, joined here today with Dr. Micah Ryan, a Boys Town pediatrician. Dr. Ryan, how are you doing today?
Doing good, thank you. How are you?
Good. Thank you so much for joining. We're going to be discussing ways to keep babies safe and healthy over the holiday season, which is very timely. We just had Halloween
Absolutely.
yesterday. So if you're watching live and you have a question for Dr. Ryan as we go through our live discussion, go ahead and leave it in the comment section and we can do a live Q&A at the end. Please make sure to like this video and fill out the RSVP form that is linked above this video to be included in our giveaways for the expo. Lastly, I want to remind everyone that we are doing in-person meet and greets next week on November 10th. So if you're interested in meeting a Boys Town pediatrician in person as you prepare to deliver your baby, you can do so by signing up. We'll leave that link here in the comments section. Okay, Dr. Ryan, so let's get right into these questions. The first one is, how susceptible is my child to illness as a newborn?
That's a great question because actually they're very susceptible. When they're born, their immune system pretty much is not even there. So every virus, every bacteria is practically brand new to them.
Yeah, definitely good to know. So what do we need to know then, with them being so susceptible, about the spread of germs and the newborn's more fragile immune system?
Yeah, well, it's all about taking lots of precautions. Doing a lot of just, it sounds very basic, but just the basics of just things like washing your hands.
Mm-hmm.
It's going to be things like really protecting your kiddo from where they are and where they're going and who's around them. And then, unfortunately, if you were to get sick yourself, well, there's measures you have to take as well.
Yeah. So this is a common question that, especially in this post-COVID world that we're in with visitors at the hospital. So after I give birth, should I limit the number of visitors at the hospital and at home during those first few weeks?
Well, there's actually a couple different ways to respond to this question because one thing that happened during COVID, a lot of the hospitals said no one can come visit you.
Yeah.
Now, what happened was something very, it was beautiful. Moms and dads could actually rest.
Yeah.
They could actually bond with their baby, spend time with their baby. Oh, do I remember the times coming in, especially if I were around on that newborn late in the afternoon, and there is about 20 people in the room. And I see mom in the corner who's just about ready to go into a seizure from being so exhausted and tired. And that poor baby is just losing it. So from that one standpoint alone, think about who's going to come up, just because it is important for you to bond. It's important for you to spend time with your baby, but it's also time for you to rest and recover because, having a child is not an easy thing. As far as, so who do you get to choose? I would say, close loved ones, people that are, maybe, the closest inner circle to you would maybe be in the hospital. Obviously, they cannot be sick at all.
Yeah.
The hospital makes sure of that as well. But the bigger question is, well, what about when you come home those first couple weeks? I tell all my patients, do not take your baby out if you don't need to. One thing about newborns, there is, I hope I'm not going to offend any of those weirdos out there that touch newborns without asking, but there's weirdos that touch newborns without asking, and that is not great. But also, you may not want to take them out to, church, to work, because you're going to feel obligated to pass them around. And those are just some things you just don't want to do. As far as who comes over to your house, once again, it's that same thing. If they can't be sick, and I'm talking not just, I have allergies, but really, because truly that was sometimes the kiss of death for having COVID during those years. But they can't be sick at all. And if they can't tell you they're sick, like maybe little nieces or nephews, maybe they just shouldn't come over. What if you don't trust them? I hate to say that, but some people will absolutely just lie through your teeth to be able to see a newborn. And so that's not something you want either. But the bigger thing is, at the end of all this, if you're not comfortable with it, you shouldn't have them over. If you're not comfortable with having lots of people come over, just say no. And if you have a hard time saying no, and I say this to all my patients, tell them Dr. Ryan said you can't have them over. Dr. Ryan, you fill in the blank, okay?
Go ahead
It,
and just blame the pediatrician. They
blame
said
the pediatrician. That anal retentive, just my goodness, that pediatrician of ours just said no one come over. I have not had a grandma or grandpa at the back steps of my doorstep yet with a baseball bat yet. So until then, blame
yeah.
us.
Yes. And I know it's so hard and it's such a special time to have a newborn, especially around the holidays
Absolutely.
but it's totally one of those things like Dr. Ryan said, it's kind of a go with your gut thing and now is the time to really set those boundaries. So I'm
Yeah,
glad.
because you just don't want you just don't want to be doing something that you're going to be nervous about because they're going to leave and then you're going to be getting a gastric ulcer for the next 2 weeks, worried about your baby and every little because you're still learning your baby. You don't know if is that little word snortle, are they sick or something like that, and it's just not worth the stress.
Yes,
Yes.
definitely. So, speaking of stress, Thanksgiving and Christmas time are already stressful enough for a normal person, let alone someone who just had a baby. So, what do new parents need to know about bringing a newborn around people during those holiday gatherings?
Yeah. Well, and it is definitely a time of sharing. All right. And our kiddos are our best gifts to this world, and we want to show them off and share them. Once again, you have to be kind of considerate for the situation. It might be one of those things where maybe you get to bring them, but maybe you don't you don't pass them all around. Maybe if it's starting to get if it's too big of a gathering, maybe you bounce a little earlier than staying the whole duration. It's just little consideration. Once again, it goes back to that. Do you feel comfortable with it? And I think that's different for everyone. A first-time parent versus a fourth-time parent. I think our comfortabilities are all different, but it needs to all be within mind of our kiddos' safety.
Mm-hmm. Yeah. So what we said before, it might be allergies, but we never really know like how people are feeling unless they're honest with us about it. So what tips do you have on asking family members and visitors on, whether it be their flu vaccination status, are they COVID vaccinated? Should we be asking to
Yeah.
protect baby?
Well, some people feel it's not their business to ask those things. It's not right for them to do that. I would tell you, you're the gatekeeper to your child. And I think it's completely within reason. If they want to come around your child, you can ask those questions. The flu vaccine, I will tell you, I think this is really big. This is really big. We're already knowing that we're probably going to have a very bad flu season. Flu's already here and it just turned November. I think this is a very reasonable one to ask to make sure people have their flu vaccine. I know some people don't ever get their flu vaccine, and that can sometimes make for kind of a tough decision. I remember when I was doing my training at UNMC, the infectious disease doctors had once said that if those people that get feel kind of gross with the influenza vaccine, have them take Benadryl around the clock for 2 or 3 days, and that really does help quite a bit. It's one of those things where I think it's important for the flu because we absolutely put kids in the hospital with influenza, and that can get really bad. 104 fevers. They can't tell you they're having headaches. They can't tell you they're having body aches. They can't. They are sick for 10 to 14 days. It's a big thing. So I think a flu vaccine is very reasonable. I think people that are going to be around your kid a lot should make sure that their pertussis is up as well. That's the P and the Tdap. I think that'd be a very important one for, especially if everyone's going to be around them quite a bit. The COVID vaccine, this is a hot button topic right here. Everyone has their thoughts on the COVID vaccine. It's not just a medical thing. It's a political thing. It's a social class thing. It's a religious thing. I mean, it's all over the place. So there's a lot of different views on this one here. I think it's good to be vaccinated for COVID. I think that, any kind of protection you get is great. I think how hard you want to go on this one here, I'll tell you, do what you feel is best. Like I said, this I only say this because this is a really hot topic button here for a lot of families. And, I definitely, you got to kind of sometimes balance that, risk versus, benefit kind of ratio of all these kind of calls. And that's really for everything in our kiddos' lives. But at the end of the day, you got to do what you feel comfortable with. And if you're comfortable with them not having their COVID vaccine or maybe not having the newest booster, that's, like I said, I think you have to go with your gut on that and stick to your guns and not feel bad about it either.
Totally.
Yeah.
I see a question coming in here in the comments. So just as a reminder, we'll do all of our Q&As here with Dr. Ryan at the end. So if you're watching live and you have a question, now's the time to comment. Okay, so the next one is definitely something I think people have dealt with is setting boundaries and ground rules for family members at holidays. You know, I had a friend who had a baby last year right before the holidays, and she went to her family gathering and said, I would really appreciate it if you guys just would refrain from kissing him on his face or getting super close to him. And they all were like, yeah, of course. And then, of course, as soon as they're passing him around and they're holding him and see how cute he was, and maybe grandma snuck a kiss in or two. So what advice do you have for when that happens? Because just as we said, it can be kind of uncomfortable
Yeah.
in this situation and telling people, but like you said, we are the advocates for our child.
We are the advocates for our children, and I would say I think it's very reasonable to tell them all they have to wash these hands,
Yes.
wash their hands. I would tell you to have some sort of blanket or a gown or something between them and the baby, just so they're not touching the baby with their clothes, because our clothes can be sources of infection risks. I think, and this is, once again, this is another little hot topic item here of wearing a mask. Really what it comes down to, masks don't help us as much from prevent us from getting sick, but masks do quite a bit for, if I was sick, to protect my little baby from getting sick. So I think it's really reasonable. If they want to hold your child, it's okay to have them wear a mask. That's another, I think that'd be, important to do, because, and we're not even talking about COVID things here. We're just talking about anything. There's many more illnesses right now that are, much more worse than COVID is for little newborns. So I think it's okay to let them have them wear a mask, just so they're not breathing on them too. Because the ways you get infections, you can eat it, you can touch it, you can, but respiratory is a big one, and us breathing on that little baby. That also kind of helps the whole kissing thing too, because you block their mouth off. And and whether they, well, can I just kiss them on the top of the head? Well, once again, that's still just another one of those infection risks. True stories, that have happened before was, a lot of people have cold sores sometimes, and if they were to kiss a baby on the top of the head, that baby could actually get a pretty significant infection. And all of us pediatricians, we've seen it. It's been scary, because that can that could really hurt a baby's brain. And so, once again, just grandma just loving on her newborn, and so, once again, I think you are in charge here. You are the parent. That's your child. It's your job now to help that kid grow until being an adult and being healthy. And yeah, we got to do what we have to do. But I think, wash your hands, wearing a mask, having a gown on, I think that's very reasonable. What if little nieces and nephews want to hold them? Same kind of situation. How about how you feel? We're germ spread, but if you did, they have to be sitting down. You put a blanket down. You set your little one in their arms. You pick your little one up from their arms, and that would be the only way you'd allow a little one to hold them, at least. Yeah, that's a great question.
So, we mentioned here at the beginning how delicate newborns' immune systems are, since, they don't really get their vaccines right away, things like that. So what are some ways that parents can help their newborn's immune system become stronger?
Well, probably the most important is breastfeeding. There is really nothing second to that at this age. And a mom's breast milk is going to be antibodies in that, and she'll share those antibodies with your newborn. Your newborn will actually be able to fight off some different types of infections. It doesn't take a scientific study for us to show how, hey, the kiddos that are breastfed, those kids, we don't see them as much, which is good. So breastfeeding is going to be, now, what if you can't breastfeed? You can pump. That's a good alternative. I definitely say that all this is such an important thing. We're still having issues with formula shortages and all that jazz, and which is just, once again, scary when you're in that situation where you don't know if you have enough formula to feed your baby. So definitely going hard with the breastfeeding, or at least milk pumping as much as possible. You're in the hospital. They have lacticians. Those are specialists that come around and help you with your breastfeeding. Use them. Use them and abuse them while in the hospital, because they just go around in a circle. If you don't ask for help, they'll come once a day. But that's it, Lucy. So use them, abuse them. When you get home, there's different places where you can go to get lactation help, because it's, like I said, it's very important to keep that going. If you can't breastfeed, you can't pump milk, because there's definitely sometimes some anatomic reasons, some health condition reasons why you can't. This is going to be where then they're going to have to build their immune system just naturally, which means, unfortunately, you don't want to let them get sick initially. So it is really about very much protecting them, and hopefully, they don't get the raw end all of these bad deals and viruses that we're seeing right now as they get. That's the breast milk is going to be the most significant way. Yeah.
Mm-hmm. And we actually did go live just yesterday on breastfeeding with Dr. Alexis Sawyer. So if you missed that, it's on our page. And
yes, very good.
Great. So like I said, we've got a few more questions here for Dr. Ryan. If you are watching live and you have a question, you can either comment below or message our page privately, and we can get it answered for you. Okay, the next one is, can I give my baby cold medicine?
Oh, I wish.
Yeah.
I wish. There's, nothing worse. As a pediatrician, when you come to my office and I have to tell you those terrible words, it's just a virus. There's no antibiotic for it. So what can I do, doctor, for it? Well, so there is definitely some things you can do. I mean, there is no cold medicines for babies. In fact, they don't even make cold medicines for little kids at all, just because of dosing issues in the past. You can do Tylenol. Tylenol helps with fevers. It's hard for me to give you that recommendation just as of yet, unless your little newborn's getting a little older, because any fever this first month of life is actually very significant. It's actually considered a medical emergency. I wouldn't want you hiding a fever with Tylenol if that's the case. So I would really kind of hold off on anything like even Tylenol until they're a bit older, out of that really dedicated amount of time when it's really dangerous. You can't do ibuprofen until you're 6 months. In some circumstances we can give Benadryl, but even then, Benadryl's meant for allergies, not necessarily illness. It might help a little bit, but at the end of the day, I'd want you to talk to us so we can because it's very much a weight-based dosing. The other things to do though, run a humidifier. Those are fantastic. I mean, I'll tell you, I believe in those. Those work. As an adult, you should be using a humidifier when you get sick. We are running our heaters now. It's drying out the air. When the air gets dry, our nose naturally gets more stuffier. Our mucus gets thicker. It's easy to get nosebleeds. All these good reasons to run a humidifier. If you have one of those whole home humidifiers, make sure you crank that on. But even when you're sick, get that little personal one. Get that going in the bedroom. That's going to be very important for the newborns. I think every parent needs to get one of those little nose freezers. I'm not talking the bulb suctions. Bulb suctions are great for getting out puke out of the mouth, but they are almost worthless for getting mucus out of the nose. Ours, my parents, your nasal cavity goes all the way from here down, so you are not suctioning a lot of that. So the nose freezer, you actually have to put the other end of the tip in your mouth, and you're actually creating that suction. Now, I remember when it first came out, I was like, this is the most disgusting thing I've ever. I mean, who came up with this? This is gross.
Right.
There is a filter. There's a filter. You're not going to get an aspirated booger pneumonia on this, okay, guys? It works fantastic. Every parent should have one of those. It's a good idea to get some saline or saline drops, because the saline breaks up mucus. You go and put some saline in those, and then you suction. Man, it really gets a lot of good mucus. So those are some really big important tips. I know, an old thing to do is do some Vicks on the toes or stuff like that. I would not do that yet, because that you can actually irritate the skin. And all Vicks does is it's just really just an irritant to the nose to help it run. So I would hold off on that still. You can prop them up just a little bit, especially if you have like a bassinet where you can just raise one side, just, 10, 15 degrees, or on a crib, just one notch up. That can kind of help things out a little bit as well. But a lot of times it's just a lot of TLC and just help them through it.
Yes.
Yeah.
So for all you expecting moms out there, add the Frida baby bulb section to your shopping list, because we've done, a handful of these expo lives already before in the past, and that has been brought up a few times. So
it's amazing.
Okay. The next one is, what should I do if my baby gets sick after a holiday gathering, say when we're around other people?
And this is kind of where utilize your resources. Family members, remember, not everything passed down is always works or is actually a good thing, but you can definitely get a good sense for hey, what should I do in this situation? We at Boys Town, we have our 24-hour nurse line, which is during the day it's all our nurses, a whole system, our city system nurse line overnight. But lots of good information for, do I need to bring them in or what can I do? And our nurses are really well trained to give you all the great information. But also, if there's something that is, hey, us doctors need to answer, they're going to send it to us, and we'll be letting you know too what we can do for it. I always think like it's going to be, there's a God-given thing. Now, us dads, for whatever reason, we don't really have this, but it's called a mother's intuition. Okay, a mom's instinct here. I tell all my moms, you know what? Listen to your instincts. If your gut says, I don't like what I'm seeing, I don't care what anyone else says. Actually, I want you to listen to those instincts. It's going to serve you well. It's going to serve you well. The worst thing we do as parents is we get kind of, oh, I don't want them to think I'm that parent, or, oh, man, I just went in that one. Don't worry about that. Don't worry about that. The time you ignore your instincts is the time that something bad will happen. So trust your instincts. Trust your instincts. I think that's important. But if nothing else, have them seen. Have them seen. We try to create lots of opportunities for you to be able to make it into our clinic. And so trust your instincts is probably the most important thing on that.
Perfect. So the last question I have before we get into our live questions here is, what about going to daycare over the holidays and, throughout flu season? Say I'm a mom getting ready to go back to work after having a baby.
Yeah.
What do I need to know about keeping my newborn safe as they're, in a germy place like daycare?
I think it's important to make sure you talk to your daycare and see what they do. I will tell you only from the perspective of hoping that it'll give you a little bit of ease of your conscience. You could have a daycare provider that is diagnosed OCD. I'm talking they are cleaning things 15 times in a row. They go overboard. Kiddos are going to spread stuff. They will. They share pacifiers, they share bottles, they share a toy and give it to their friend. Know that if it's the first time going back to daycare, pretty good money on it that they're going to have a sickness within a week. Definitely within 2. It doesn't mean they're going to get horribly sick, but it just means, yes, it's going to happen. They're going to be building their immune system, which is unfortunate, but still it has to happen. There's your daycare should post things where if they know like hand, foot, mouth is running through, or RSV as we are having now, or XYZ. A lot of times they'll post those so you know what to be looking for, just so you can obviously kind of prepare and know when, hey, do I need to go to the doctor sooner than later? But it really is your kids will get sick. They will get sick. That's just the unfortunate truth. Daycare is a lot of times it's a necessary evil. We have to work. We have to be able to provide for our family, and a lot of times daycare is that way. Maybe don't have family that can take care of them. Although if you did have family that could take care of them, great option. Do you do an in-home daycare versus a daycare center? There's lots of pros and cons between that, and I think that's something you could talk with your pediatrician about. But just know that they will get sick. They will get sick. And like I said, sometimes it's just something we have to do. If you didn't have to in daycare, well, absolutely don't. But or if the cost is almost a break point from just staying home, stay home. Daycare is expensive too.
Yeah.
Yeah.
And we did a whole video too last expo with Dr. Sarah Orr on how to prepare to go back to work after baby.
Yeah.
So I'll link that here in the comments. And we talk extensively too about daycares and all things like that. So, okay. So I'm going to go ahead and read this one question. Before I do, I want to remind everyone watching live to please like this video. And, if you feel so inclined to share it with your other parent friends, we'd really appreciate that. If you're watching live, or if you're watching later after this live video concludes and you still have a question for Dr. Ryan, go ahead and comment it or message our page directly and I can pass it along to him to get it answered for you. Okay, so this one says, our 8-week-old was born 7 weeks premature and spent a month in the NICU. First of all, congrats on your baby. We're so happy for you. Does that make her more susceptible to illness than full-term newborns? She says, we have family wanting us to attend holiday dinners coming up, but I feel like she is too vulnerable.
Well, during their time in the NICU, they were pretty well protected from sickness. Because remember, when we get born, what's happening? We're being exposed to things every day of our that we're alive. Just the new things in our environment. So they might have been exposed a little bit. Obviously being a little bit bigger or a little bit older, they've been exposed to a little bit. If they're born that early, they're essentially, I think it was ended up being almost a newborn kind of, just corrected gestational to 40 weeks if they went, cooked longer. So they're still very, very, very vulnerable. They're still very vulnerable. Maybe not as vulnerable as a baby that was just born, but still, I think you still have to be just as cautious. You have to be just as cautious with who's around them and, how you make that hard decisions. And once again, it sounds like from the way the message is put, it sounds like I think your gut's already telling you probably what you need to do. And I would say listen to your gut.
Yes,
Yeah.
that's kind of the theme of this talk.
Yeah.
Listen to your parental instincts.
Mm-hmm.
You got it. So awesome. Well, thank you, Dr. Ryan, for all your expertise on this topic. We are going to be live tomorrow with Dr. Sarah Orr on allergies. So we'll kind of build on this conversation as well.
I do have a few more holiday things, though, if that's okay.
Of course.
Yes. So obviously we are running into this time of the year when we're running our heaters quite a lot. Now, make sure your furnaces have been, properly checked out and serviced. Why? Is because that could be a carbon monoxide issue. And so make sure you also have carbon monoxide sensors. That's something definitely to be thinking about as we're going into this fall. Remember, when you have lit candles or fireplaces, well, those don't hurt until you touch them. And so, especially if you have any little crawlers around, make sure you kind of watch for those. If you end up putting up a Christmas tree, especially a live one, remember to watch it. That becomes quite the fire risk as we get into this time of the year. Doesn't take much. There is a lot of things around the Christmas tree that are breakables, chokables. So definitely keep that, especially for those parents maybe have a 9-month or 1-year kiddo walking around with your newborn here, is that there's going to be things they could pull off a Christmas tree or things they can chew on, like lights, that are just not safe. So make sure you watch for that. Mistletoe, holly berries, and poinsettias are toxic to babies, very toxic. So do not, even your infants too, do not let them, make sure that doesn't get into their hands. A lot of times as we are at holiday gatherings, sometimes there's adult-like beverages. Don't leave those hang around for those that have toddlers, because they will drink that as well. And that's not a funny situation. And then, of course, it's going to be cold out. It might be get cold out, not far from now, but make sure you bundle your kids up pretty well. It doesn't take very long, especially for newborns whose skins are very sensitive to actually get thermal injury, cold injury. So make sure they are bundled up. That's why you have those carriers have the cover all the way around them. Don't spend too long outside too as well. That's gonna, 20-30 minutes for your little toddlers, about as much time as they need. Yeah. So I just want to throw that out there.
No, thank you. That, so there's so much to remember around the holidays, but especially with little ones, it's all super helpful.
It's a great time though.
Yes, of course. Well, thank you so much, everyone, for watching. Like I said, we're going to be live every day this week for the Newborn Expo. So make sure you fill out that form linked above this video so you can be included in all the giveaways and be notified when our videos are going out. So thank you so much for watching. Dr. Ryan, thank you.
Thank you.
All right. Have a good one, everybody. Bye-bye.